Hey everyone, it's Nurse Danny, and I am joined today with Dr. Dorsey. He is a psychiatrist, and 3 delightful, lovely ladies that we've had on 2 times before. And I want you guys to have a chance to introduce yourselves as well. And this all kind of stemmed from a project that you guys started last semester, right?
Mm-hmm. Yes.
Yeah. So you were in a marketing class, and you polled teens and found, you came up with a list of questions that teens want to know more about. And on the list were some mental health questions. And so that's what we're here to talk about today. That's why we have Dr. Dorsey with us. He's the expert. And this topic is really near and dear to my heart. I have 3 family members who struggle with mental illness. And so I'm very anxious to learn more about this too, both from the perspective of if you're the one struggling with it, what do you do? And if you have a friend or a family member struggling with it, how do you help and support them? So that's what we're going to talk about today. Dr. Dorsey, introduce yourself.
So I'm Kai Dorsey. I'm originally from Oklahoma. That's where I went to med school. And then after I got done with the med school, I joined the Navy and was a flight doctor for a while. So I did some fun primary care stuff, got to ride in the back seat of a fighter jet for a while. Then I had to grow up and pick a long-term career. So I went to a psychiatry residency in Baltimore and learned a whole lot about psychiatry, how the mind works, how it can sometimes not work. And then I moved out here with my wife up to Ogden, where I work at McKay, and just get to help patients and do things like this, where I get to help people understand a little bit more about psychiatry, because it's a pretty poorly understood field, and we're still a baby science too. So we grow all the time in our knowledge, and we're always seeking to understand what's going on in the brain and the mind a little bit better.
There's something really cool going on at McKay Hospital too. There's basically like a special ER for mental illness. Tell us a little bit more about that.
You bet. So it's something called the Access Center. And we have some of those that are popping up at different Intermountain hospitals. But essentially it's a place that you can go if you're in crisis, but not necessarily need medical attention. If you're just, really struggling, there's always somebody there 24/7 who you can talk to. And, the goal is to help people cool off if they're feeling really upset, if they're in crisis, get some plans of how they can be safe, and then get them back out into life. And the goal is to hopefully not have them have to come into the hospital, but hey, if they need to, it can be helpful for that as well.
Available.
Mm-hmm.
So increasing access for people that need help with their mental health. I love that. Okay, so ladies, let's start with you, Talia. Tell everyone a little bit about you, and maybe since you're the first one, introduce the project a little bit as well.
Okay, no pressure, I guess. But so I'm Talia Smith. So I'm a senior at Harriman High, and I didn't really start off in this project initially. I was just kind of helping them because I was involved with other projects, but I'm still involved with like FBLA and DECA. But these beautiful ladies, they were asking me questions and just like, hey, about women's health and different things like that. And I was like, well, this would be interesting if we talked about this, we talked about that, but I wasn't really on the project.
You're kind of interested in the healthcare field too,
yeah,
right?
I am. So. Yeah, I'm not sure my footing or what I want to be yet, but I am interested. But then later on, my advisor, who is also ahead of their project as well, was like, hey, because I interned at Jordan Valley Hospital, and I got to shadow some nurses and some doctors, and I got to learn new things there. And so she's like, well, you're interested in the medical field. Like, why aren't you on this project? And I was like, I don't know. I guess I will now. And so I've kind of been thrown into this project, but I'm so glad I did because it's fantastic. And I'm glad to be gaining all this new information and talking to amazing doctors and clinicians and being able to not help myself, but also people around me. So
definitely, this is a great project, you guys. Yeah. Hey, Riley.
So I'm Riley Atkinson, and really what this project is it's a marketing, broadcasting, creative project. So we wanted to work with our FBLA and DECA classes to bridge the gap between like your maturation age of 5th and 6th grade to women's health. Because teenagers, we have co-ed health classes.
In between, right?
Yeah, exactly. We don't have specific women's health for our age group. And so that's really what we're trying to do, is show that there is resources for us. So we're in broadcasting, we're in FBLA and DECA, and I do student government, and just really involved with school.
You guys are busy ladies. Yeah. Involved in a lot.
Always on the go. So I'm Meryl Holt, And I was in FBLA last year, not DECA. And then this year I was like, it's my senior year, so I really want to get involved. And I started doing DECA. And we're all a group of girls in this project. And that's why we kind of decided that we wanted to do this creative marketing project on women's health. And so far it's been amazing. Like she said, we've helped not only ourselves learn more, but like the people around us and like them watching and everything with our self-care and medication and stuff like that. Like people have learned a lot around us. I think that's awesome.
Yeah, for sure. Well, on our first discussion, we talked a little bit about sleep. And Dr. Dorsey, what does sleep have to do with mental health?
Oh, man.
How much does that affect it?
So it's one of the cornerstones of our brain's functioning, right? If you don't sleep for several days, eventually your brain shuts down. But the funky part is we don't know what sleep does. We have no clue about the inner workings and how it restores the brain. We have some ideas, but nobody is really quite sure yet. As far as mental health goes, it's kind of a chicken and an egg thing, both. At times, sleep is, if you're getting healthy sleep, 8-9 hours, especially at your age, you need to be shooting for around that time.
And let's pause for just a second. How much sleep do you guys all get a night on average? Talia?
Like 6 to 7.
Mm-hmm.
Riley?
Probably 6 to 7.
Yeah, 6.
Meryl? I remember you guys saying like 5-ish last time we were together. Was that because it was Christmas?
That was because it was like the holiday season. We were crazy busy, but now we've just...
Teenagers have a hard time getting a lot of sleep, so they should be getting 8 to 9 hours.
8 to 9 hours, because your brains are going so fast during the day. They're also going through a myelination process where the wires are kind of getting this coating on them. They need as much restorative time as you can give them. Plus, it'll help you remember things better, help you do better on tests and all that other stuff. But like I said, it's chicken and the egg. So sometimes if people do develop like a depressive episode that's part of an illness, the ability to fall asleep can be taken away from you. Either the ability to fall asleep early in the evening, or waking up in the middle of the night and not being able to go back to sleep, or waking up way too early and then, 3 or 4 a.m., then you're up and you just can't sleep even though you're tired. And so it's one of those things that if you're vulnerable to depression, if your genetics are vulnerable to depression and you're not sleeping very well, then that alone could bring on a depressive episode. So that's why it's really important at this age. You got to be making sure you get those Z's because, well, you want to be high functioning anyways, but it will also help keep away the possibility of depression.
Okay, so let's all be honest here. Who has felt sad in the last week? Feeling sad is pretty normal, right? What's the difference between sadness and depression?
So I always like to isolate that term depression first because everybody uses it now. It's part of pop culture. Everybody, has their own definition of what they mean by it. Some people just mean, I'm just really sad today, so I'm depressed. Well, we can use that as kind of a nickname for sadness, but major depressive disorder is an actual illness. And when I talk about depression with patients, I'm talking about an episode of depression as part of an illness, meaning, I got to unpack a few terms just so that we're all on the same playing field, because depression is terribly, terribly misunderstood. Think about your brain. It's an organ, right? And it functions like your heart, your liver. All these organs have their own purpose, their own function. The purpose of the brain is to create the mind, or at least that's one of its purposes. The mind is the property that the brain creates. So the mind has all these functions like memory, thinking, feeling, all the things that kind of make life what we know. And if you think about it, let's say if somebody came and hit you on the head and you lost your memory. Well, we understand that, right? That's kind of a well-known concept because part of the brain contains our memories. There's also parts of the brain that help control our mood, how we feel about ourselves, like our self-respect, self-esteem, and our sense of vitality or our sense of well-being in our body. They have all these funky names like amygdala, hippocampus, limbic system, all these very complex sub-organ parts and names, but they function to regulate those three things: our mood, self-attitude, and our sense of vitality or well-being in our body. And for some people, those parts of the brain can go on the fritz and they can stop working like they normally do. So your mood can go down, your sense of self-respect or self-esteem can go down, and then your ability to sleep, your sense of energy, your sense of vigor, get up and go, gets up and goes. And when all those things happen at the same time, we think what's going on is those parts of the brain aren't working like they should, and we call that a depressive episode. So that's a technical term that I use. And that's different than, feeling sad or feeling grief, or feeling anger. But all of those feelings can come along for a person going through depression without necessarily anything to cause those feelings. Does that make sense?
Mm-hmm. So yeah, as I listen to you talk, it seems like when I reflect on my teenage years, all of those feelings were heightened just because you're a teenager and you've got tons of hormones and everything. So do hormones play a part in this, and are teenagers at higher risk for becoming clinically depressed?
So clinical depression, typically, if we're talking about major depressive disorder, you all are at the right age to begin having your first episodes if you're going to have them. The thing is, we don't yet know the complex genetics of who will be at risk, and then there's also some
genetics
stressors.
Definitely play a part.
Absolutely. And so, yeah, of course, when hormones are going up and down every day, that's going to mess with your emotions just by itself. But there are probably some inflammatory markers that can lead to depression. And when those hormones get going, they can kick up other hormones, and then you can have one of those episodes. So yeah, y'all are dealing with life right now, right? You're dealing with classes, grades, tests, boyfriends, girlfriends, etc. You're dealing with the prospect of college or finding what you want to do. I remember going through that. That alone is enough of an emotional roller coaster. But there are some people, especially at this age and in your early college years, that is when you got to watch out for those big drops that come down. And so does that kind of answer the question a little bit?
Yeah. So maybe your ability to recover may be a part of it too. Like you go through sadness, you go through grief, you experience anger, but your ability to recover from it too may be a sign of whether or not you need help.
You bet. Statistically speaking, depressive episodes, if they go untreated, they last for weeks to months. This isn't like I was sad for 3 days, that must be depression. It's we're looking at least a couple weeks, but before we ever had medications, 8 months, something like that. So this would be a pretty profound change from a person's normal baseline. That being said, people have different baselines. There are some people who are kind of Oscar the Grouch, some people who are kind of Eeyore, and then some people are kind of like Tigger. So the idea is that that's okay. If you're like that, hey, the world needs all types of different people, right? But if you drop from that baseline,
so if you're Tigger all the time and then all of a sudden you're Eeyore for a while,
that may be a red flag, and especially if there's not like a real reason for that to happen. But if you're Eeyore and then you just drop even further and nobody wants to be around you, well, that may also be something you're like, oh, maybe I'm not myself right now. And that's the idea. Depression takes away your ability to feel like yourself. It's not just sad. It's so much more than that. It takes away your ability to want to get up and go. It takes away your ability to enjoy life. And in fact, those are some of the criteria that we look for when I'm talking to patients to see, hey, do we need to start treating this or not?
So if we kind of nail it down for what teenagers and adults alike should look for, changes, long-term changes in your mood, not being able to recover from periods of sadness, not enjoying things that you used to like, maybe feeling a little bit emotionally numb. What else?
Feelings of guilt or worthlessness that you can't quite pinpoint. And again, some people have chronically low self-esteem for whatever reason, but we're talking about a drop. So if I always feel I always question myself, or I'm always kind of a little self-conscious. If you get to the point where I cannot be around people because I'm just the worst person in the world, that should be a bit of a red flag. So mood, self-attitude or self-respect, and then that vitality or sense of that get up and go in your body. Those are the 3 things that I always tell my patients to watch out for. Most of the time, by the way, it's not the person themselves that realizes they're going through a depression. It's the people around them. Sometimes the person is maybe a little more irritable than usual, and it just doesn't get better after a couple days. They think they're irritable about one thing. Yeah, me and my boyfriend, we had this fight, so I'm just angry at him for a couple days. But then you notice that you're angry at everything for weeks and weeks, and everybody around the person is just starting to feel like they're walking on eggshells, and they're not used to that with that person.
And if their mom and dad comes to them or a friend and says, how are you feeling? I've noticed some changes in you lately. The first response is probably going to be defense, right?
Absolutely. Because they're saying, hey, you're not acting like yourself. Or they're when somebody's angry at you, it's easy to be angry at them, right? And so the people around them are like, why are you talking to me like that? Well, it may be that's what they're going through, and that's kind of how they're trying to get through it as best they can. So it takes a lot of understanding, but usually it's mom and dad or brother and sister who notice, and they'll say, this isn't the person I know. This isn't the Camaro I'm used to. This is somebody who's really different right now, and I don't know what's going on. She just can't recover. She can't feel good about herself, and we've tried everything we know how, but it's not getting better.
So let's say that Talia was concerned about her sister. How would she approach her? What are some good strategies for that to help the person instead of drive them away?
First thing to do is remember, she's still a sister. You still love her. You're there you're worried because you're noticing something that isn't normal. Something's not stirring the Kool-Aid with this person, and you're a little bit concerned. Approach her like you would approach her about anything else. I don't know if you have a sister or not, but
or a friend.
Yeah,
or
maybe
a friend. Whoever.
Yeah.
Two sisters actually.
But you would, if it's me, that person best. You know what will get them upset, what won't get them upset. Try to just do it as most non-confrontational. Just like, hey, just know I'm worried about you. I know you've been upset, and that just doesn't seem like you. And I'm just wondering if there's anything going on. And that's one of the best ways to start a conversation. It's open-ended. You're not accusing them of anything. You're not unloading how it makes you feel onto them, because that will usually make them not want to talk about it. If you have that concern, just remember that's why you're approaching it. It's out of concern. It's not out of anger. It's not out of wanting them to change right now. It's something's not right.
And then they have the opportunity to open up to you, or maybe they choose to not at that moment, but think about it later and know that you're there for them.
Mm-hmm.
Yeah.
Absolutely. And most of the time they'll remember that you were the person that came first. Mm-hmm. And because oftentimes when people are going, especially their first or second depressive episodes, they're going to be kind of prickly. And they remember how it makes a lot of other people around them feel. And because they hear that feedback, that negative feedback a lot, to get somebody who comes in and just drops that negative feedback and just says, hey, I'm just worried about you. That they remember that when they get better. And they say, you were that person for me. Thank you for doing that.
Do you guys have specific questions for Dr. Dorsey?
I feel like we've talked a lot about depressive episodes, but what other mental illnesses affect teenagers?
Sure. So depression is part of a bigger construct called affective or mood disorders. And they come in two big flavors. Depression, like we've talked about. Bipolar disorder. Y'all have heard this, that diagnosis tossed around a lot. That is, you're also at that age where you could be developing symptoms of bipolar disorder. Think about, so if we talked about depression being a drop from your baseline in your mood, self-attitude, and sense of well-being for weeks, months at a time, bipolar is people who get the depressions, but they also get a pop, or what we call a manic or hypomanic state that will last for weeks, or at least maybe, sometimes it burns out after about a week, but where all of a sudden you don't need to sleep, or you're only sleeping a couple hours, but you wake up and I'm ready to go. I feel amazing. Talking fast, thinking fast, doing fast, kind of like somebody puts a battery in you and you just go. That usually gets more attention. If it's mild, people are just like, great, finally Talia's cleaning her room, and but she's cleaning it all week and she is doing a great job. Keep it going. But every now and then it can get to a point where people are talking so fast and thinking so fast that the mind starts losing those logical connections, and people will be like,
Or they make really spontaneous choices and decisions that aren't good for them.
Risky behaviors. Yeah. Spending a lot. It's essentially it's that mirror image of depression. It's just, instead of feeling really bad about yourself, you feel amazing. I'm invincible. I have so much energy. And you really do have energy. It's one of my professors when I was in residency, she has bipolar, and she would describe it as like your brain giving itself cocaine, and you're just going. Problem is, after all that high runs out, you usually crash into a depression. So that's another type of illness to look out for. Most of the mood disorders are one of those two categories. Seasonal affective disorder is really a big issue right now because we have the inversion that keeps us from getting sunlight. Our brain starts producing more melatonin, which is our sleep hormone, and it will give you what generally looks like a depressive episode.
What about anxiety?
Anxiety.
I think, I think it would be helpful to discuss too, like, it's normal to be anxious about certain things. You have a big test coming up. You have a job interview. You have to come do this live stream today. but what's the difference between that and like anxiety that you might need help for?
Let me start out with asking y'all a question. What is the purpose of anxiety? Why do we have it? Every human has it built into their circuits. Why?
Fight or flight.
Okay.
Yeah, to keep us from doing dumb things or keeping us safe.
Keeping us safe. I like that. Think about it this way. Anxiety is your threat detection and response device. It's what nature or God or whoever built into us to make sure that if that bear is chasing us in the woods, we are running the other direction. Or if I didn't study for that test and I've only got a couple days left, I have a whole lot of extra energy to make sure and study because I don't want to fail that test and lose scholarship or anything else. It's there to let you know that something bad may happen if you don't act. And whether that's engaging or running away, that's where we get that feeling. Think about it as very similar to pain. Pain is there to let us know that our body is getting hurt. Something is damaging our tissue and it needs to stop. And it doesn't feel good when you're experiencing it, right? Anxiety doesn't feel good. Nobody likes feeling anxious. Your heart rate goes up, you're sweating, you're kind of shaky. When I do these kind of like live streams and radio shows and stuff, I usually get a little bit of shakiness. So you guys might see that coming up in a few minutes. But that's just that animal part of my brain telling me, hey, there's a threat. You could look really silly here. And I don't like that feeling. Nobody does. When anxiety becomes an issue, there are some people who we think those anxiety circuits are cranked up a little bit more than they should be. When it becomes a hindrance to your functioning, when it makes you not be able to study because you're so worried about the test that you can't get over how much you're worried that you can actually study and be effective, or you're so worried about going out in public. And it's not just that you have, maybe some questionable self-esteem or anything like that, but you get kind of that paralyzation. That's when we need to treat it because it doesn't do you any good. It's now become an out of proportion function of that mind that's now hurting you. It was there to help you, but now it's hurting you. And so whether it's through therapy where you just kind of learn how to, soothe that part of your brain or through medications that can decrease that anxiety reaction. There's a whole host of different ways that we can address it, but look for that function. That's when anxiety, we call it a disorder because although it had a purpose, it's now disordered. It's hurting that person.
It sounds like you guys had some questions about medication specifically, which is one of the treatments. What questions do you have about that?
Well, I know, going back a little bit to depression, I know that there are some people out there who still think, they tell people who have depression, to just get over it, just be happy, you know what I mean? But that's not the case at all. And it's what would you say to those people to inform them, hey, it's not the case because you can't just tell someone to be happy. I would say probably would be, you know what I mean?
Usually you're going to see this in families that have never had somebody who's had depression before. People can have be the first person in their family to have an episode of depression. And so they're like, you just need to pull yourself up by your bootstraps, right? That's the saying we always hear, or snap out of it, or, you just need to get over this, or it's, you're not being spiritual enough. You're not praying enough. You're not strong enough. I'm from Oklahoma, and that was a big thing where I grew up. It's we strongly believe this is it's a diseased process of the brain. In 100 years, we'll have the CT scans or MRI scans that'll prove everything that we're trying to show, because we know that it responds to medications. If it wasn't an illness, it wouldn't respond to medications. But right. I will tell patients, it's like you're trying to run a marathon right now with a broken leg, or it's like a family who would be upset at their child for developing diabetes. You don't control it. You're not trying it. Nobody wishes for depression, right? That is not something that anyone would crave. Now, that being said, depression can affect how we behave. And if we let it affect us to the point where we're not getting out of bed, we're not trying and all that, then that's where that family's going to get a little bit upset. But it is not something the person's doing. Nobody would want that. Nobody would try to do that. Educating the family, educating the person that, hey, this is an illness. It is treatable. that when we do studies that use certain medications versus sugar pills, the people on medications do a whole lot better, a whole lot sooner, and stay better than the people on that sugar pill. If it was just not trying, it wouldn't work like that. The studies wouldn't show that, but they do time after time after time.
Do you guys feel hesitant to talk to friends that you might think are struggling with it?
Well, I mean, personally, I've gone through depression and anxiety, but like I don't like to give them advice or anything. I mean, I'll say like, oh, well, like if it really continues, then go talk to someone, go see medical help if it really is a big problem. But I try not to be like, say, a doctor. I'm not like, okay, well, take 2 ibuprofen and I'll see you in the morning. Like, I'm not like that. I tell them like, well, this is what helped me. And, find something that helps you. If exercise, kind of helps you a little bit more, try to get you out of bed or something like that. Or, go talk to someone, make sure that I've learned from my experience that keeping those feelings bottled up inside never helps you or doesn't help anyone. Yeah. So I think even talking to like my family or talking to my parents, or if they have anyone, or if they don't, then like finding an adult or someone that is qualified for that helps a lot.
Yeah, I personally am like, when, no one's really came up to me ever and like said like, hey, can you help me out? But like when there are like suspicions, it's kind of scary to go up to them because like you don't know what to say. And like with someone who doesn't have experience with it, or with someone who like is like kind of uneducated with it and they don't know how to help them or something, it can be really scary to go up to them, but obviously you want to be there for like emotional support, and you want to be there for them to vent, but you don't know how to help them. But is that helping, like just being there for them?
What do you think? If you were struggling with depression or just couldn't get to where you were feeling better, would that be helpful for you?
Yeah, I think kind of like what Talia said with like having it like kept in a bottle like isn't good. But like, yeah, would you just tell them like go get some help like from a doctor or something? Like real help?
I would tell them, hey, if this is becoming an issue where you're not functioning, you can't feel your emotions, you're not feeling like yourself, it's at least time to go see if somebody could evaluate and see if there is something going on. It may be that it's just life threw you a whole bunch of curveballs and it's really hard. You had a breakup, failed a test, heard bad news about a scholarship all in the same week, and that's going to make it look like a depressive episode. But why try to judge it yourself? Why not go talk to somebody and at least get on their radar? So maybe you're just like, I don't know if I have depression or not, but I'm concerned I do. Start that relationship, and then you follow up every month, every 2 months, and they could say, over this time I'm seeing, X or Y, and I think this is depression, or no, I think this was just a hard time in your life. And then, okay, well, I'm feeling better now. I'll come back if I feel worse.
I really like what you said earlier too about like just being there for the person. Because with people in my life who have struggled with it, someone who's very close to me in particular, sorry, I did not plan on crying today. He came back to me after one of his worst episodes, after he wanted to kill himself. And he said, you were the only one who was there for me. And it was just little things like, hey, do you want to come have dinner with us tonight? Do you want to come hang out with us and do something? Do you want to come play a game? Just listening for a few minutes. I think all those little moments add up to mean a lot to that person, to know someone's there. So if they do decide to bare their heart and soul, someone's going to listen to them and won't judge them. Sorry, guys. What do you do, though, if it escalates to that and someone starts talking about suicide? It's no longer just depression, but they want to hurt themselves. How do you respond to that as a friend or a family member?
Suicidal thoughts can be pretty common in depression. Usually it starts out with what we call passive death wish. It's a feeling of, I just wish I wouldn't wake up kind of thing. It's not saying I want to kill myself, but it just starts feeling so bad and it's so hard to keep going that you're just like, I'm done. But then that can progress to saying, you know what, maybe it's not just this feeling so much. Maybe I need to act on it. Usually it starts as thoughts that the person just pushes away, dismisses. But if depression keeps building up, it can get to that point where they start making some plans and they start thinking about some things. First of all, for everybody, not just you, but throughout your life and people things to watch out for are people who have been really struggling, and all of a sudden, overnight, they just kind of look like they have this piece about them that they're very relieved, but they're not telling anybody about why they're relieved. Or if they start giving their things away. Or if they start making kind of reflective statements like, I just want you to know you're always there for me. Thanks for that. Red flag, red flag, red flag. That's when you should be talking to them and saying,
I have
hey.
a friend whose son planned a day with each family member before he took his own life. And when they looked back in the week leading up to, he'd called his brother that lived out of state and arranged a time to go have lunch with them and hang out with them.
Yeah.
And he'd had that interaction with everyone. Looking back, that was unusual, but they didn't think it at the time.
Because a lot of times we're just saying, oh, maybe they're just trying to pull themselves out of it or whatever it is. When you see those changes, those abrupt changes, engage that person and just say, hey, how you doing? I appreciate the compliment. Thanks for letting me know I'm always there for you or whatever they say, but how are you doing? Are things, I noticed you were struggling the past couple of weeks. Is that still going on? How much are you struggling with it? A tip that I always use and that we get taught in our training is ask open-ended questions to people. And don't, you're not trying to get to some answer and like, tell me you're suicidal. Nobody's ever going to do that, right? But just ask them how they're doing. Ask them if they're struggling. Ask them how bad they're struggling. That stuff will come out naturally because most people, depression is going to want to make you isolate. It's going to want to make you bottle up and not tell anybody. But usually it's kind of under pressure. So as soon as somebody kind of lifts that lid, it comes out because it's a hard load to carry for anybody. And so keep an eye out for those things. And you asked about, how you approach people. Put yourself in their position and just ask what you would want. And then ask so you're talking about anxiety about asking someone, right? Anxiety is that threat detection device. What's that actual threat that you're worried about? What's the outcome that you're scared might happen?
I think just saying the wrong thing and making it worse, or having the person want an answer from me because they're coming to me and me not giving it to them and then just them lashing out.
Sure.
I'm really terrified of making it worse, and that's why I feel like just not saying anything, but then again it's like that probably doesn't help any.
So let me disarm that threat for you. Showing care doesn't make it worse. And you'll be amazed at how much people can forgive if you come to them with pure motivation of just loving them. I don't know if I've ever seen that make anything worse. And people are very forgiving, even if it comes out wrong, even if you're stuttering, even if they could tell that you're nervous. As far as having to have the right answers in my job, because our science is still so young, I have to tell people all the time in a professional setting when they're paying to see me, I don't know. I don't know the answer. But what I can say is if you're struggling, I'm here for you. If you're suicidal, hey, let's get you to the hospital. Let's call 911 or let's call a crisis hotline.
Yeah, resources. I think it's important for you guys to know what resources are there so that you can help them find them. What resources should they use for themselves or give to their friends?
So my good friend Google and I are very close. That's where you can always start. It's very easy. Put in crisis hotline sometime into Google, and you'll have hundreds of responses. And so, as long if it's either through a government or through a university or a healthcare organization, most of those are very, very reliable. You can start there. Outpatient treatment, so outpatient diagnosis. Getting somebody set up and say, hey, maybe we should just call and get you an appointment set up. Or talking to that person's parents and saying, maybe it's time to get you on the list. And that's the unfortunate part about mental health care right now, especially in Utah. A lot of times there's wait lists. So while we're waiting, while we get you on this wait list and it's a few weeks, maybe we should just go talk to your primary doc. Primary doctors are equipped to talk about these things, at least in basic terms, and to at least do some primary evaluation.
Now that may involve talking to a parent. So I want to close today with talking about if you've been struggling, whether it be yourself or you have a friend who's struggling, how do you talk to parents about it? Because that's a really hard conversation to have. For one, it takes admitting that you have a problem and then talking to your parents about it. That can be really, really scary.
Coming from a teenage perspective, I think it depends on the relationship you have with your parent. If you're really close to your parent and you have a problem, I feel like you'll want to tell them, even if it's hard, you'll go to them. If you struggle with your relationship with your parent, maybe it's a teacher or a school counselor. They're there for you just the same as your parents are. And so just make sure you find that reliable adult figure.
Yeah, good advice. Reaching out to someone who can help you. Yeah.
I'll echo that. I think parents come in all different, shapes, sizes, flavors. Some are healthy parents, some are not healthy parents. Find that adult that you trust, that has, especially if they have some type of official capacity where they're there to protect you, like a school counselor or something like that. Those are usually very healthy people that you can always talk to, and they can get you those next steps or get your friend those next steps. And that's the thing. We always worry that we got to have those answers. All you need to know is, what next step do I take? And who can tell me what that next step is?
And even if you don't know it, you can say, let's find it together. Because now that person has someone in their arms that they can rely on and trust going forward too.
I think that phenomenon alone is probably the most life-saving thing when it comes to mental health, is that feeling that somebody's there. Whether it's a friend, family, therapist, psychiatrist, I have that somebody who knows what I'm going through, and they're in it with me. I'm not in this alone. That's that lonely feeling that I think is that dangerous part of depression that can come in. So again, going back to just loving on people, being there for them, and just being genuine with them. It doesn't matter if you mess it up. It doesn't matter if you fumble through it. That can save a life.
I love it. Do you guys have anything else that you would like to ask Dr. Dorsey? I think that's a great way to end. Just love people. Thank you so much for joining us and giving us your time. Girls, I've loved the time that we've been able to have with you, and these messages are invaluable for teenagers and adults alike. I think everyone can learn from this discussion. So thank you so much for prompting it and being a part of it today. Thank you so much for joining us too. I hope that this was helpful. And of course, if you have questions for me, you know where to find me on Facebook. And Dr. Dorsey, where's your practice?
I'm up at McCady, up at Ogden.
Okay, great. Thanks again for joining us. Everyone, have a great day.